Assalamu alaikum. I'm Dr. Mahnoor, and today the topic of our practical is prescription writing. The objectives of this lecture is to learn the standard pattern of prescription writing, to know about the parts of prescription, and to understand the basic terms and abbreviations used in prescription writing. An instruction written by a medical practitioner that authorizes a patient to be issued with a medicine or treatment is known as prescription. Prescription is divided into three main parts. That includes heading, which contains patient's information including name, age, sex, marital status, address, and contact number. The body contains instructions about medicine to the patient as well as to the pharmacist. While closing contains information about the prescriber, that is, the doctor prescribing the medicine, such as doctor's name, designation, qualification, registration number, contact information, hospital address, signature of the doctor along with the stamp. The body of prescription is further divided into four important parts. Superscription, in which capital R and small x is an abbreviation for recipe, the Latin for take thou, that is, you should take this. Inscription contains the medicine with its strength. Transcription, in which signa, sig, or signatura means to write or to make a label, in which doctor gives instructions to the patient about dosage of medicine, for example, route of administration, quantity, when to take or how many times to take the drug, or for how many days, along with vehicle, adjuvants, corrigents, and correctives. Subscription is a part of prescription in which doctor instructs pharmacist to dispense medicine along with its quantity. Basic terms include basis, that is the chief ingredient, meaning the main medicine. Vehicle is a carrier or inert medium used as a solvent or diluent in which the medically active agent is formulated or is administered. Adjuvants mean the secondary active drugs that are given to assist the action of basis, that is the chief ingredient or the main medicine, whereas corrigents or correctives are given to correct any undesirable action, that is the side effects of active ingredient. Here you can see parts and standard pattern of prescription writing are given. First of all, there is heading, under which patient's information comes, that is the name, age, sex, marital status, and address. The date is written along with this. After that, in body, you have to write the diagnosis of the patient, and then RX, which is superscription. After superscription, inscription comes, in which the name of medicine is given along with its strength. After inscription, you have to write transcription or signa, which includes the dosage of drug, that is the quantity, when to take and how many times to take the drug, and for how many days, along with the route of administration. If there are any vehicle, corrigents, correctives, or adjuvants, you have to write them. In subscription, instructions to the pharmacists are given, that is to dispense how many medicines. In closing part, doctor's information is given, which includes doctor's name, qualification, registration number, contact information, and hospital address. The signature of doctor and stamp is given at the end. A fictitious example is given here. As you can see that the name, age, sex, marital status, and address of the patient is given along with the date. After that, diagnosis is written, for example in this case, arthritis. First of all, you will write RX, which means you should take the drugs given below, and it is known as superscription. After superscription, you will write inscription, which includes the chief or main ingredient, that is basis, which is the main drug in this case tablet ibuprofen, which is an NSAID. 400 milligram is the strength of the drug. In transcription, you will write the route of administration, which in this case the drug is given orally, twice a day, one in morning and one in evening for 5 days after meal, because it is an NSAID with water. Pain relief gel to be applied topically when needed. This statement is also a part of transcription, but this pain relief gel is adjunct, which is used to give an extra or added effect to the main ingredient. Whereas capsule Ryzek 40 mg orally once daily in morning, half hour before breakfast with water for 14 days is given as a corrective, because ibuprofen is an NSAID, so we have to give the stomach cover along with this to prevent GI irritation. In superscription, we write only RX. In inscription, the main drug. In transcription, all the added information. And after this, subscription comes, in which the doctor gives instruction to the pharmacist. For example, to dispense 10 tablets of ibuprofen 400 mg and 14 capsules of Ryzek 40 mg. After subscription, the information of doctor comes, in which the name, signature, the designation, contact number, registration number, and the hospital address is given. Another example is given. So the command here is to write the prescription for a patient with acid peptic disease. So you will follow the standard format given here in exam. After name, age, sex, marital status, address, which is the heading of the prescription, and also the date, you will write the body, which includes diagnosis, in this case APD, acid peptic disease. After that, superscription, that is RX, then inscription, in this case capsule Ryzek 40 mg orally for 14 days once daily in morning, half hour before breakfast with water, which is transcription. Syrup Digex MP 2 tablespoons orally when needed in case of GERD symptoms. It is an adjunct. This is a part of transcription. After that, subscription comes, in which you will instruct the pharmacist to dispense 14 capsules of Ryzek 40 mg capsule and 1 bottle of syrup Digex MP. Then you will write your name, registration number, contact number, and the hospital along with the city in which the doctor is prescribing the drug. Dose is calculated according to the age and the weight of patient. Care should be taken while calculating dose, especially for children and patients with old age, as they have different metabolism than an adult. You should know if the female patient is pregnant, or if a patient has any allergy to any drug, or has any other disease or family history while prescribing a medicine. For dose calculation in children, you should know the adult dose, and some formulas which are used commonly are given as here. Dosage calculation in neonates, infants, and children. The formulas which are commonly used include Young's formula, which is used for children of 2 years and above age. In this, age in years is divided by age in years plus 12 and is multiplied with adult dose. In Clark's formula, weight in pounds is divided by 150 and multiplied by adult dose. Whereas in Freud's rule, which is used for infants up to 2 years, age in months is divided by 150 and then multiplied by adult dose. Common abbreviations used in prescription are PO, which means per oral, SC, meaning subcutaneously, IM, meaning intravascularly, IV, which means intravenously. Then OD means once a day, which is actually once in 24 hours. BD means twice a day or 2 times a day, also meaning after every 12 hours. TDS means 3 times a day, which means after every 8 hours. QID means 4 times a day, that is in morning, noon, evening and night. HS means at bedtime. SOS means if necessary or when necessary. AD means up to. AC means before meal and PC means after meal. These abbreviations are for our own understanding and are used in exams. Please don't use these when prescribing in clinical setting. You should use the language that the patient understands. In Pakistan, doctors usually write instructions to the patient in Urdu language. The assignment is to write the prescription for the H. pylori eradication in patient with diagnosis of peptic ulcer induced by H. pylori. You should write the prescription according to the standard format given. Thank you. If you have any questions, you can contact me. Allah Hafiz.